Welcome back to the deep dive. Get ready. We're plunging into a topic that's critically important and, let's be honest, pretty scary for any pet owner. What happens when you suspect your animal's been poisoned?
Hmm.
And for this deep dive, we're kind of pulling back the curtain on veterinary emergency medicine. We're using insights from, well, basically the kind of expert text vets themselves use veterinary poisoning and intoxication therapy.
That's right. It's like getting a peek at the playbook vets reach for when, every second really counts.
Exactly. So our mission today is to walk you through those essential steps they take, right from the moment a potentially poisoned pet comes through the door, through all the complexities of diagnosis and life-saving treatment.
Yeah, understanding this process is key.
And knowing these steps, it's not just like academic knowledge, it's practical. It could genuinely help you know what to expect, maybe what you need to do in a terrifying situation. And it definitely gives you the deeper appreciation for the skill and speed involved.
Absolutely. The complexity and the critical thinking needed. Okay, so let's get into it.
Right. So an animal comes in acutely ill, no obvious injury, no known chronic issue flaring up. Is poisoning immediately top of mind?
It often is, yeah.
Yeah.
Or at least it's very high on the list of possibilities you have to consider.
Yeah.
When the picture is sudden, severe illness and other causes aren't jumping out, poisoning becomes a strong suspect.
Okay, so faced with that acute situation, that emergency,
Right.
what's the absolute #1 priority? Is it immediately trying to figure out what they ate?
Actually, no. The most critical first step isn't nailing down the specific toxin. It's stabilizing the patient. You have to deal with immediate life threats first. Think ABCs: airway, breathing, circulation. You get those under control before you dig deep into the what.
Right, right.
Treating the signs, stabilizing the animal, that's the priority, comes even before confirming the poison or factoring in, say, pre-existing conditions.
Stabilization first.
Yeah.
Makes sense. Okay, so once that immediate crisis is being managed, what are the kind of bigger picture goals the vet's working towards?
Well, there are several key things happening, often simultaneously. There's that initial emergency intervention, obviously, then preventing any more exposure to the toxin,
Okay.
then trying to prevent what's already been ingested from being absorbed into the body. After that, maybe giving specific antidotes if one actually exists for what you suspect.
If you're lucky enough to have one.
Exactly.
Hmm.
Then, speeding up the elimination of any toxin that has managed to get absorbed, providing good general supportive care, managing temperature, breathing, heart function, that kind of thing. And, really importantly, talking to you, the owner, about what's going on, the prognosis, the aftercare.
It still sounds like having some idea of what happened, what they might have gotten into, is super helpful, though.
Oh, absolutely crucial. If you have any of the suspected material, the packaging, even samples like uncontaminated vomit or urine, bring it. It's incredibly valuable.
Why is that so important?
Well, two main reasons. First, it helps the medical team make a faster diagnosis. And in poisoning, time can literally be the difference between life and death. Getting the right treatment started sooner.
Okay.
And second, there's the medical legal aspect. Having good records, keeping that physical evidence, it's crucial for the case itself and sometimes, sadly, for legal reasons down the line. And it helps with future cases, too.
Right. Okay, so let's put ourselves in the owner's shoes. I call the vet, panicked, saying, I think my dog ate something bad. What might they tell me to do before I even get in the car?
The #1 instruction pretty much always is going to be get your pet to the clinic as fast and as safely as you possibly can. Time is just critical.
What if I live far away or there's some reason I can't leave immediately? Any advice then?
Yeah, if transport is delayed, the main things are try to keep the patient calm and keep them warm. Minimize stress.
Oh, okay.
And here's something people might not think about. Depending on the symptoms or what you think they got into, you need to warn anyone else who might handle the animal.
Warn them.
Well, the animal might be acting erratically due to the toxin, or there could even be residual toxin on their fur or in their saliva that could pose a risk to handlers. So, caution is needed. You might even need to consider safely muzzling the patient if they're very agitated or painful.
Good point. Okay, what should I absolutely make sure to grab on my way out the door?
This is vital information. Grab any urine you might be able to collect, maybe slip a clean container under them if possible, any vomit if it seems uncontaminated.
Right.
And definitely bring the suspected substance itself or whatever is left of it, and crucially, its container or packaging. Even just the label provides a huge amount of information for the vet.
And how should I transport those samples? Just wrap them in a paper towel?
No, ideally use clean containers.
Yeah.
Clean plastic tubs or clean glass jars are best. Avoid contamination.
Okay, clean containers. Got it. All right, so I've rushed my pet and my samples to the clinic. Now the vet team becomes detective. How challenging is it for them to figure out exactly what caused the problem?
It can be incredibly difficult,
Oh,
especially getting a definitive diagnosis right away,
Why is it so tough?
simply because the number of potential toxins animals can encounter in their everyday environment is just vast, mind-boggling, really. Think about everything under your kitchen sink, in the garage, medications, plants, foods.
Yeah, the list is endless. So, where do vets turn for help when they're facing this?
Thankfully, there are excellent resources. Things like the ASPCA Animal Poison Control Center, the Pet Poison Helpline. These are fantastic services staffed by experts.
Mm-hmm.
There are also local human poison control centers that can sometimes help, and state diagnostic labs. These resources are especially powerful when you do have that container or label. They can often provide very specific treatment advice quickly.
But what if? What if the symptoms my pet is showing don't really line up with what I think they ate or what the label says should happen?
That's a really important point. If the clinical finds what the animal is actually doing, their symptoms contradict the suspected toxin or the label info, you have to treat the signs.
Treat the patient, not the poison, kind of thing.
Exactly. The patient's actual condition and symptoms must guide the immediate treatment, not just the suspected history, which might be wrong or incomplete.
So, how do they eventually confirm what it was? Does that happen later?
Often, yes. Definitive confirmation usually relies on chemical analysis of blood, urine, stomach contents, or sometimes tissues. But that testing takes time, sometimes days.
Right, you can't wait days to treat.
Precisely. That's why the initial assessment, stabilization, and symptom-based treatment are so vital. But getting that confirmation later is still important. It helps refine ongoing treatment, helps vets learn for future cases, and again, it's invaluable if any legal questions come up. Detailed records are key.
Okay, so stabilization's underway, maybe there's a strong suspicion, or maybe they're just treating the symptoms they see. The source material talks about the main pillars of treatment. Can you break those down?
Yeah, the text groups them into sort of three main categories. There's supportive care, there's emergency intervention, which is closely tied to that initial stabilization we talked about, and the big one, preventing absorption of the toxin.
Okay, let's start with supportive care. What does that typically involve?
Supportive care is all about managing the patient's overall body systems that might be struggling because of the toxin. It's things like controlling their body temperature, keeping them warm if they're cold, cooling them if they're overheated, supporting their breathing and heart function if needed, correcting imbalances in their blood chemistry, like acid-base levels, managing pain, controlling neurological issues like seizures or tremors. It's basically keeping the body functioning as normally as possible while it deals with the insult.
Right, keeping them stable while the other treatments work, or the body clears the toxin. And emergency intervention, that sounds like the really immediate life or death stuff.
Exactly. These are the critical, hands-on actions when an animal is truly crashing. Making sure they have a clear airway, maybe breathing for them with artificial respiration if they've stopped.
Okay.
Performing cardiac massage chest compressions, usually, though sometimes internal massage is needed in extreme situations like during surgery, and using a defibrillator if they have a life-threatening abnormal heart rhythm. These are the immediate lifesavers done right at the start.
Got it. Stabilize, then get more specific. Okay, that third pillar, preventing absorption, that sounds like a really major strategy.
It is. It's a huge focus because if you can stop the toxin from getting into the system in the first place or limit how much gets in, you significantly reduce the damage.
So how do you do that? What's the first step?
The simplest, most obvious step is just removing the animal from the source. If it's something they're inhaling, get them out of that environment into fresh air.
Makes sense.
And this is crucial for owners or anyone helping make sure you don't get exposed yourself while rescuing the animal.
Yeah.
Some toxins can be harmful to people too.
Good safety reminder. What if the toxin is something on their skin or fur, like they rolled in something nasty?
For external exposures, thorough washing or bathing is really important. You want to physically remove the substance from the skin and coat before more can be absorbed through it.
And I guess the same safety warning applies.
Absolutely. Wear gloves, maybe protective clothing, depending on what it is. Be very careful not to contaminate yourself or others while washing the animal.
Okay, washing for external stuff. What about toxins they've swallowed? I think the first thing many people think of is trying to make them vomit using emetics.
Right, inducing vomiting emesis is a common technique, but it has significant limitations.
Like what?
The main one is time. It's generally only considered useful if the animal ingested the toxin within the last hour or maybe 2 hours,
Why only that window?
because after that, much of the stomach contents have likely moved into the small intestine, the duodenum. And once it's there, making them vomit won't get it out.
Okay. Are there situations where you should absolutely not try to make an animal vomit?
Yes, definitely. This is critical. Never induce vomiting if the animal is unconscious, very weak, or having trouble swallowing. The risk of them inhaling the vomit aspiration pneumonia is too high.
Right.
Also, don't induce vomiting if they've swallowed something corrosive, strong acids, strong alkalis like drain cleaner, or petroleum distillates like gasoline or kerosene. Vomiting those back up can cause severe damage to the esophagus and lungs.
Any other contraindications?
Yeah, you also generally avoid it if they've already received a tranquilizer or something else that suppresses vomiting, because
Yeah.
it just won't work and again increases aspiration risk.
So, assuming it is appropriate, how do vets actually induce vomiting?
Well, for dogs, one of the most reliable injectable methods uses a drug called epimorphine. It usually works quite quickly, within a few minutes.
Injectable. Okay.
Yeah. And if the epimorphine itself causes any adverse effects, like prolonged vomiting or sedation, it can be reversed with another injection, a narcotic antagonist like naloxone, though epimorphine availability can sometimes be an issue.
What about for cats? Is it the same?
No, apomorphine isn't very effective in cats. For them, a different injectable medication, often a sedative called xylazine, tends to be more successful at inducing vomiting. And like apomorphine, xylazine's effects can also be reversed if needed, with drugs like atipamezole or euhimbine.
Okay, those are vet options. What about something I might have at home that I could use before getting to the vet?
The most commonly recommended emetic for home use, specifically for dogs, is 3% hydrogen peroxide.
The stuff you get at the pharmacy.
Exactly. There's a specific dose based on weight given orally. It's important not to overdose it. There's a maximum dose, but it's not a guarantee. It's generally not effective in cats, and even in dogs, it doesn't always work.
What about older home remedies? I feel like I've heard people mention things like syrup of ipecac or even salt water.
Syrup of ipecac used to be used, but its efficacy is pretty low, and it's generally not recommended anymore. And definitely never use it with activated charcoal. They interfere.
And salt water.
Absolutely not. Using salt or a strong salt solution to induce vomiting is dangerous. It can cause severe salt toxicity, hypernatremia, which can be life-threatening itself. So please, no salt water.
Wow. Okay, that's a really critical warning. Good to know. So let's say vomiting is induced, or maybe it's not appropriate or doesn't work. What's the next step? Activated charcoal comes up a lot. What does it actually do?
Activated charcoal is a cornerstone of decontamination for ingested toxins. It's important to understand it doesn't, neutralize or detoxify the poison.
Okay, so what does it do?
It works by absorption. It's incredibly porous, has a huge surface area. It acts like a molecular sponge in the stomach and intestines, binding many types of toxins to its surface.
So it traps them.
Exactly. It traps the toxin molecules, preventing them from being absorbed through the gut wall into the bloodstream. The charcoal toxin complex then just passes out of the body in the feces.
What kinds of things does it work well for? What does it bind?
It's effective for a pretty wide range of substances. Many common insecticides like organophosphates, some rodenticides, heavy metals like mercuric chloride, plant toxins like strychnine, and lots of common drugs, barbiturates, alkaloids like morphine or atropine, even things like ethylene glycol, which is antifreeze.
That's quite a list. Are there common toxins it doesn't work well for?
Yes, definitely. It's not a magic bullet for everything. It's generally ineffective against alcohols like ethanol or methanol. Doesn't bind well to cyanide, most heavy metals like iron or lead, petroleum distillates, sodium chloride salt, ironically, or xylitol, that common artificial sweetener toxic to dogs.
So it depends on the toxin. How is activated charcoal typically given? Is it a pill?
No, it's usually given as a liquid slurry mixed with water. It can be given orally if the animal will take it, or often administered via a stomach tube, especially if they've just had their stomach lavaged. And it's often given after an emetic has been used, once the vomiting has stopped. That way, you've removed some toxin by vomiting, and the charcoal can bind what's left. Be prepared, though. It's messy stuff. Black powder everywhere.
I can imagine. What about the dose? And do they just give it once?
The dose is based on the animal's body weight, usually a range like 1 to 5 grams of charcoal per kilogram. Sometimes a single dose is enough, but for certain toxins, especially those that undergo intrahepatic recirculation, meaning they get excreted in bile and then reabsorbed, multiple doses might be given maybe every 4 to 6 hours for a day or so.
And I think you mentioned something about cathartics earlier. Are they given with charcoal?
Yes, often. A cathartic, which is basically a laxative, something to speed up transit through the intestines, is usually given with the first dose of activated charcoal. Common ones are sorbitol or sodium sulfate,
Why only the first dose?
because repeated doses of cathartics, especially osmotic ones like sorbitol, can pull a lot of fluid into the intestines. In an animal that might already be dehydrated or sick, this can cause severe dehydration and dangerous electrolyte imbalances, particularly hypernatremia, that high sodium level again. So standard practice is cathartic with the first dose only.
Okay, that makes sense. So we've covered inducing vomiting and activated charcoal. What about physically washing out the stomach? Gastric lavage?
Gastric lavage, yeah, basically stomach pumping. It's another method to physically remove ingested toxins.
Yeah.
Like emesis, though, its effectiveness really depends on timing. It needs to be done pretty soon after ingestion, generally within that same 1 to 2 hour window.
Is there anything absolutely crucial you have to do before starting a gastric lavage?
Yes, 100% essential. The animal must be intubated first. A cuffed endotracheal tube needs to be securely in place in their windpipe.
Why is that so critical?
To protect the airway, you're going to be flushing fluid into the stomach, and there's a high risk of aspiration getting stomach contents or lavage fluid into the lungs if the airway isn't sealed off by that cuff. Aspiration pneumonia is a serious complication you want to avoid at all costs.
Okay, airway protected. Then how does the lavage actually work?
A large bore tube, often about the same diameter as the endotracheal tube, is gently passed down the esophagus into the stomach. Then, cycles of instilling fluid, usually just warm water or saline, and then draining it back out, are performed.
How much fluid?
Small volumes per cycle, maybe 5 to 10 milliliters per kilogram of body weight, repeated many times, maybe 5, 10, or even more cycles, until the returning fluid looks clear.
And what happens after all the washing?
After the final drain, activated charcoal, usually mixed with that first dose of cathartic, is instilled through the stomach tube before the tube is gently removed.
Are there any particular precautions to take during the procedure itself?
Yes. You need to use relatively low pressure when putting the fluid in to avoid forcing stomach contents further down into the small intestine. If you suspect the stomach wall might be weak, maybe from ingesting something caustic, you'd use even smaller volumes. And of course, never force the tube. If you meet resistance, you could damage the esophagus or stomach.
Right. What about using oils? I think the source mentioned mineral or vegetable oil. Is that common?
It can be useful in specific situations, mainly for toxicants that are highly lipid-soluble, meaning they dissolve well in fats or oils.
How does oil help?
Mineral oil is often preferred because it's pretty inert and not well absorbed itself. It can coat the toxin in the gut lining, potentially reducing absorption. It also has a mild cathartic effect, helping things move through faster. Vegetable oil could also be used.
Okay. And then there's the other end, using enemas, colonic lavage.
Yes, enemas can sometimes be helpful to hasten elimination of toxins from the lower part of the gastrointestinal tract, the colon.
What kind of fluid is used for that?
Often just warm tap water, sometimes with a very mild soap like Castile soap added. There are also commercial enema solutions, some containing osmotic agents.
Any cautions with enemas?
The main thing is, again, avoiding overzealous treatment that could lead to dehydration or electrolyte problems, especially in small or debilitated animals. Just like with oral cathartics.
And I remember a specific warning for cats.
Yes, absolutely critical for cats. Do not use enemas containing hexachlorophene soaps, and do not use phosphate-based enemas like Fleet enemas. These are highly toxic to cats and can be fatal.
Very important distinction. Okay, so we spent a lot of time on preventing absorption. But what about situations where the toxin has already been absorbed into the bloodstream? What can vets do then to help get it out?
Right, so once it's absorbed, the body's main route for getting rid of many toxins is via the kidneys, into the urine. Though other routes exist too, liver processing into bile, elimination in feces, even exhalation via the lungs for some volatile things. But manipulating kidney excretion is a key strategy.
How can you influence what the kidneys excrete?
There are two main ways. One is to increase the volume of urine being produced using diuretics. The other is to change the pH, the acidity or alkalinity of the urine.
Okay, let's take diuretics first. They make the animal pee more, right? How does that help eliminate a toxin?
By increasing the flow of urine through the kidneys, you essentially increase the rate at which certain toxins dissolved in the blood water get filtered out and flushed out of the body. It's called forced diuresis.
Does this work for all toxins?
Not all, but for some, it can significantly enhance elimination. The big prerequisite, though, is that the kidneys have to be working reasonably well. The animal needs to be well hydrated and capable of producing urine. Normal urine output is roughly 1 to 2 milliliters per kilogram per hour.
Now, what if they're not producing much urine? Say kidney function is already impaired by the toxin.
If you have oliguria, very low urine output, or anuria, no urine output, then forced diuresis won't work, and you might need to consider something like peritoneal dialysis instead.
What drugs are typically used for diuresis?
Common choices are powerful diuretics like furosemide, usually given intravenously. Sometimes, if the initial dose doesn't work, the dose might be increased. Another option is mannitol, an osmotic diuretic, also given IV, but usually as a slow infusion.
Okay. Now, the other strategy you mentioned was changing urine pH. How does altering acidity or alkalinity help get rid of toxins?
It's based on chemistry and how drugs move across membranes. Many toxic compounds are weak acids or weak bases. Their ionization state, whether they carry an electrical charge, depends on the pH of their surroundings.
Uh-huh.
Ionized molecules generally don't cross cell membranes easily. So if you make the urine pH the opposite of the toxin's nature, you can trap the toxin in its ionized form within the kidney tubules.
So it can't get reabsorbed back into the blood.
Exactly. Stays ionized in the urine and gets excreted. So for an acidic toxin, like aspirin or barbiturates, you want to make the urine alkaline. For an alkaline toxin like amphetamines, you want to make the urine acidic.
Clever. What do they use to change the urine pH?
To make urine more acidic, sometimes just giving intravenous saline, 0.9% sodium chloride, can help, especially as given rapidly. Oral medications like ammonium chloride or ethylenediamine dihydrochloride can also be used.
And to make it more alkaline.
The main way is by giving intravenous sodium bicarbonate.
Okay. And you mentioned peritoneal dialysis if the kidneys aren't working. How does that work?
Peritoneal dialysis is a technique where you basically use the lining of the animal's own abdominal cavity, the peritoneum, as a filter. A special dialysis fluid is infused into the abdomen through a catheter. Waste products and toxins from the blood diffuse across the peritoneal membrane into this dialysis fluid, which is then drained out and replaced. It's effective even if the kidneys have shut down. It can also be used just to remove certain absorbed toxins, even with normal kidney function.
Can you combine that with the pH idea?
Yes, interestingly, you can. You can actually adjust the pH of the dialysis fluid itself to enhance the removal of specific acidic or basic toxins across the peritoneum using the same principle of ion trapping.
Wow, that's quite sophisticated. Okay, so beyond supportive care, preventing absorption and enhancing elimination, are there any other major treatment modalities we should cover?
Well, standard intravenous fluid therapy is almost always part of the plan, just for hydration, volume replacement, and supporting circulation. Using crystalloids, maybe colloids if needed. But another therapy that's gained a lot of traction, especially in recent years, is lipid emulsion therapy, often called ILE or sometimes II.
Lipid emulsion therapy, sounds like.
Yeah.
Giving them fat intravenously.
That's precisely what it is. It's an intravenous infusion of a sterile fat emulsion, the same kind of stuff used for intravenous nutrition sometimes.
And this helps with poisoning. How?
It's become a really valuable tool, particularly for toxicities caused by substances that are highly fat-soluble or lipophilic.
What kind of toxins are we talking about?
It's shown really promising results for a range of things. In human medicine, it gained fame, treating overdoses of local anesthetics, some antidepressants like clomipramine, and certain heart drugs like verapamil.
And in animals?
In veterinary medicine, it's been successfully used for toxicities, from the muscle relaxant baclofen, overdoses of beta blockers or calcium channel blockers, and common antiparasitic drugs like ivermectin and moxidectin, especially in sensitive breeds.
So how does infusing fat actually counteract a fat-soluble toxin? What's the theory?
The leading hypothesis, though the exact mechanism might be complex, is called the lipid sink theory.
Lipid sink?
Yeah. The idea is that when you infuse this concentrated fat emulsion into the bloodstream, you create this expanded lipid compartment within the blood plasma. The fat-soluble toxin molecules that are circulating or maybe even starting to move into tissues like the heart or brain are drawn towards and partitioned into this infused lipid.
So it traps the toxin in the bloodstream, but away from the target organs.
Essentially, yes. It sequesters the toxin within the fat emulsion, making it less available to exert its toxic effects on vital organs. It acts like a sink, pulling the toxin into the lipids.
That's fascinating. Are there risks or side effects associated with giving IV lipids?
Yes. Like any therapy, it's not without potential risks. Reported adverse effects can include things like hyperlipidemia, high fat levels in the blood, obviously,
Yeah.
potential effects on the liver or spleen, jaundice, sometimes pancreatitis, seizures have been reported, effects on red blood cells or clotting, and very rarely fat embolism. So it's used carefully.
Is there a standard way to give it a protocol?
There's a commonly used protocol, often extrapolated from human guidelines, typically using a 20% lipid emulsion. It usually involves an initial bolus dose given fairly quickly over maybe 5 to 15 minutes.
Okay.
And that's often followed by a slower continuous rate infusion, or CRI, lasting maybe 1 to 2 hours. In some cases, if the clinical signs start to return after the infusion stops and the blood serum doesn't look overly fatty or lipemic, the bolus or CRI might be repeated.
So with all these techniques, emesis, charcoal, lavage, diuresis, lipids, does this mean there's basically a specific antidote or countermeasure for every poison out there?
Oh, I wish. But unfortunately, no. True specific antidotes, drugs that directly counteract the mechanism of a particular toxin, only exist for a relatively small number of common toxicants.
Ah, okay.
And that's precisely why all these other strategies, the supportive care, the decontamination methods, like preventing absorption, and the techniques for enhancing elimination, are so incredibly fundamental in veterinary toxicology. They are the absolute mainstays of treatment, especially when you don't know the exact toxin or when a specific antidote simply isn't available.
That makes sense. They're the tools you rely on most of the time. So once the initial emergency phase is over, the decontamination and initial treatments are done. What happens next? How is the patient monitored?
The follow-up really depends entirely on the specifics. What toxin was involved, if known? What clinical signs is the patient still showing? What did their lab tests, blood work, urine tests look like? The ongoing monitoring and care are tailored completely to the individual patient's needs and the particular challenges posed by that specific intoxication.
Wow. Okay. This has really been a comprehensive deep dive. It absolutely highlights the systematic but also incredibly adaptable approach vets need to take. Starting with that immediate life support, the ABCs, and then having this whole arsenal of techniques, some simple like washing, some complex like dialysis or lipid therapy to try and stop the toxin or help the body clear it.
Yeah, but what really stands out is that critical thinking element, right?
Hmm.
Given the sheer number of things animals can get into, the vet often doesn't know exactly what they're dealing with, especially at first.
Yeah.
So having these diverse strategies, emesis, charcoal, lavage, ways to speed up kidney function, ILE, it means they have options. They have ways to intervene effectively even when the specific enemy is still unknown.
Yeah.
It requires a lot of judgment calls based on the patient in front of them.
It definitely gives you, as a pet owner, a whole new level of appreciation for the quick thinking, the knowledge, and the decision making that goes into handling one of these emergencies. It's complex.
It certainly is. And maybe, to wrap up, connecting this back to the bigger picture,
Yeah.
think about our environment. It's constantly changing, right? New chemicals, new medications, different household products, even exotic plants becoming more common.
Yeah, that's true.
So given this ever-evolving landscape of potential hazards, how does that fundamental challenge, identifying and treating new or uncommon intoxications, continue to push the boundaries? How does it drive innovation in veterinary emergency medicine and toxicology?
That's a really potent thought to end on. How does the field keep up? Fascinating. Well, that brings us to the end of this deep dive. Thank you so much for walking us through that.
My pleasure. It's vital information.
Absolutely. And thanks to all of you for joining us.